Hi, this is Dr. Roy Kim of the Dr. Kim Show. Thanks for joining my YouTube channel today. We are going to be talking about dermal fillers in general today. So you have probably heard of dermal fillers. Basically what we're doing is filling in wrinkles. The big thing with dermal fillers is we are now able to sort of contour the face and actually contour parts of the body. The biggest indication for dermal fillers are for wrinkles, but more specifically for static wrinkles. If you have a wrinkle that, hey, it's there, and despite muscle movement, it's still there, that's the type of wrinkle that you want to hit with dermal fillers. Wrinkles that occur because of muscle movement, typically forehead or between the eyes or in the crow's feet area, that's called a dynamic wrinkle, and that is much more for neurotoxin. Botox, Xeomin, Dysport, Jeuveau, you get the drift. Regarding dermal fillers, there are a couple different chemicals that make them. By far, the most popular in the world are HA fillers, hyaluronic acid. The reason for this is because they are reversible. You can actually melt them. They're also natural. They're technically found in the joints of humans. Even though HA fillers are not derived from humans, technically humans aren't really allergic to them. So they are very popular. The two biggest brands available in the US are Juvederm and Restylane. There are a couple of the brands in the US, and there are dozens, if not hundreds of other brands scattered throughout the world. So the important thing to realize about HA fillers is that they actually have different sort of technology, cross-linking, thickness, how long they last, but not only that, how much force, support, oomph, structure they have. So just because it's an HA filler doesn't mean that you should necessarily get in the lips or cheeks. It just depends. So you don't want to have necessarily the wimpiest, least structural HA filler given in the cheek because it won't last, it doesn't give that much structure. Likewise, more cross-linked HA fillers, things that give a little more structure or oomph, you don't necessarily want it in very sensitive areas such as the lips because you may be able to see it or feel it or both. So that's a big no-no. You want to use the appropriate HA filler for the appropriate HA area of your face. There are FDA approved areas of the face that we can give HA fillers, and of course there's off-label use where yes, something's approved by the FDA, but we're giving it in the jawline, we can give it in the neck, we can give it in other areas that technically haven't been approved by the FDA, although honestly, they're pretty safe. Of course, always talk to your plastic surgeon or injector about what's the best for you. My general approach to HA fillers is to come up with a treatment plan and then talk to the patients, but have you realize that it's very cool because it's instant gratification. The other important topic is that I tend to only fill to 70 to 80% completion, not 100% completion. The reason for this is I want you to be happy. I can always add a little more, and that's very easy for me to do. For me to subtract means I have to melt it. And melting is a little imprecise because if I melt it, it will disperse in the entire area and potentially may melt everything. So, especially for my first-time patients, we're going to make sure that we have a great treatment plan for you. And actually, I'm not going to use up the full syringe and just walk out. I'm going to use most of the syringe, get to where I think it's almost done, and have you take a look in the mirror. There is immediate gratification with dermal fillers, which is one of the most awesome things about giving dermal fillers in general. And it's important to realize that even though it looks good in the office, you can maintain those looks. You want to take care of it. You don't want to press too hard right after it, massage it to disperse it. You want to help reduce swelling, which may occur immediately after dermal filler placement. There are a couple risks of dermal fillers. I think the biggest risk is honestly injecting into a blood vessel. So that's a big no-no. We take a lot of great pains to make sure it doesn't happen. I have the patients sort of hang around right afterwards to make sure that that's not occurring. And we can always melt it, of course. There are other types of fillers. They are derived from other chemicals. They're a little less popular because they're sometimes difficult to impossible to actually technically dissolve. As long as you're with a great injector or plastic surgeon, I don't think it's a huge deal because a really good injector should know how to treat patients, deal with these various substances, and also potentially dilute it and reverse some of the other fillers out there on the market. I tend to not use them as much for that reason because they're a little less controllable if there's an issue. Another big concern with dermal fillers is too much filler. So if it's given in a tiny area, of course you may develop a lump. Now I strive very hard not to see lumps, not to give you lumps. Massage may actually make the lump look better, but it's really up to the technical skill of your injector to make sure that there's no lump in the first place. We can melt it, but as I mentioned before, it is an imprecise science. Dermal filler does last a certain length of time according to the FDA. So on all of these products, it's going to be labeled, or you can ask your injector about how long it lasts. There is variation, however. So of course, all humans are different. The body is going to absorb it and break it down at different rates. The more movement you have where the filler is placed, the shorter it's going to last. So if I give you filler, let's say in an area of your face that doesn't have much movement, such as the outer cheek, it's going to actually last longer than if I give you the exact same filler, the exact same patient, but closer to the lips where, of course, you're talking, you're eating, there's more movement. And that's just to be expected. Make sure you go through the qualifications of your plastic surgeon, injector, of anybody that's placing dermal filler. There can be complications. There can actually be long-term issues where it doesn't absorb or doesn't absorb that well. So the bottom line is you want to be very, very careful and not just jump into it before you get anything placed in your face. Dermal filler is a great way to get a very beautiful aesthetic result in patients with, I would say, mild to moderate issues with lack of volume, lack of plumpness, other things like that. So if your cheeks are starting to deflate, if your lips are a little too thin, if you're noticing the nasolabial folds getting deeper over time, dermal filler is a fantastic way to look better, to look rejuvenated, and actually get a procedure in an office setting that looks good and will last about a year or so. If you have more severe wrinkles, if you have loose skin, those types of things don't really respond that well to filler. You will probably need surgery for it. So it's important to have a realistic view of yourself and of your expectations before getting dermal filler placed. Click on the links to my left for other fun-filled videos about plastic surgery. And if you have any other comments or want other topics for future YouTube videos, please leave them down below. Thanks so much for watching.